brain health and fatigue. In my last video, we actually talked about the 6 major causes of actually fatigue that are not completely health related always. We talked about lack of sleep, lack of exercise, lack of muscle mass, chronic stress, insulin resistance, and then also inflammation. Those are the 6 common causes. And as we age, there's a lot of different changes in our body, and we get more accumulation of senescent cells. And there's a couple of different ways where you can clean them out. You can take supplements, but really what we need to do is you want to get some muscle mass. I know a lot of people are on GLP-1 inhibitors and they're losing a lot of weight, but they're also losing a lot of muscle mass, and they're going to start showing some signs of fatigue, even though they've lost some weight and maybe their biomarkers are getting better. So we need to get some muscle mass. Now, you're going to go from an AMPK, which is like an aerobic activity, like zone 2 cardio, which are around 60 to 70% of your maximum heart rate. And that actually helps clear senescent cells. It's good for your body. As far as longevity goes, that is really probably the best way you can activate sirtuin genes in order to actually live longer. But at the same time, if you keep doing that, you're not going to maintain the muscle mass that you need. So then you need to actually have spurts of working out, going through protein synthesis, and that's actually called MTor. MTor is actually going to increase muscle mass, right? So both of those are going to work on the brain. First of all, there was a study done just not too long ago that a person did this for 6 weeks, 4 times a week, where they actually rode a bike, and they rode it for 3 minutes. They were around 75, 80% of their max heart rate. And then that last minute, they hit it their all. They do 4 cycles of that. And by the last cycle, you are going to be tired. And they said the brain changes that you had were astronomical. And they said the thing was, they stayed in effect for 5 years. And this was a long-standing study. So exercise and muscle mass are all going to play into fatigue. For number one, you have mitochondria. Your mitochondria, everybody knows, they're the powerhouse of the cell. They produce ATP, right? Well, ATP, we would die if we didn't have it. And a lot of the energy in our body is ran by our brain. And we have to have NAD. Well, NAD needs to get in the cell. The best way to do that, of course, exercise is some things you can do, but you can also take a supplement called NMN, nicotinamide mononucleotide. You can also take a supplement called nicotinamide riboside. It's called NR. Now, there was a study just out recently that said that NMN actually was the only one that actually entered the muscle cell. So after a few week trial that they had done on people that were exercising, the NAD levels in the muscle cells only went up with NMN, not NR. But NR is supposed to cross the blood-brain barrier better than NMN. So I take both. It depends on what I'm doing. If I'm trying to work on muscles and trying to gain some size and have energy, I'll turn around, I'll take 500 milligrams of NMN and 300 milligrams of NR a day. Then if I'm wanting to have some brain health, I'll turn around, I'll alternate that, and I'll take 600 milligrams of the NR and only 250 milligrams of NMN. But again, that's things that you don't actually have to do. My main thing is you want to go through AMPK pathway and the MTOR pathway. The AMPK pathway is exercise. Don't try to kill yourself. Try to be able to do about 25, 30 minutes of good, solid exercise to where you could probably talk to somebody during exercise, but if you went over that, in other words, a little bit harder, you would turn around, you would lose your breath, and you wouldn't be able to talk. You're just a little bit too high, because then you can't sustain that. If you're going to do that at the very end of the exercise, because then you're going to be able to get the aerobic activity and the benefits of that, and the angiogenesis of mitochondria, because you're basically stressing the cells in order to produce more energy. And the only way the body's going to be able to do that is to produce more mitochondria. And there's supplements you can take for that, like PQQ and so forth. But we're not going to go into all that today. What I really want you to know is, if you want to get better brain health, you need to exercise. And you also need to obtain more muscle mass. So I already told you how to do the AMPK pathway. What you do is you turn around, You work out 25 to 30 minutes, 3 to 4 times a week, and you're going to hit around 60 to 70% of your max heart rate. My recommendation, I'm going to say 70%. I think most people can go at 70% of their max heart rate and be able to go for 30 minutes, no problem. You do want to stress your body just a little bit. And I think that going the lower level for too long, you're really not getting the benefit that you need. Next, MTor. MTor is activated by the amino acid leucine. And it's been proven that you need to have around 2.5 to 5 milligrams of leucine in order to activate protein synthesis. Now, I ain't saying that if you went out and you worked out and you turned around and you had 5 meals a day and they were only 30 grams of protein and you didn't have enough leucine, that you're not going to get any protein synthesis. I'm not saying that at all. I'm just saying that if you really want to get the benefit out of the protein that you're ingesting and make it worth your while, because protein is expensive, whether it's in a supplement or whether it's a steak or fish or chicken, it can get expensive if you're wanting to maintain size. My recommendation is just get some whey protein that has and ingest at least 2.5 probably to 4 milligrams of leucine. That activates the protein synthesis. So you need, me personally, I feel that you need to do that within 30 minutes of after working out. Okay, so now you've done the AMPK pathway, which helps with longevity. It helps with sirtuins, genes. It helps with your overall well-being. And you're also, it's going to improve mitochondria. You're going to get more mitochondria from it. So it's going to increase your energy. But then also you're going to have to alternate that with a little bit of working out, get some muscle mass back on your body. And we already say a body in motion stays in motion. If we become sedentary when we get older and that's all we do, we're going to feel the effects of it. So again, it's not rocket science. It's just getting out and doing it. You just have to have the perseverance to do it weekly. And some people, you need to get into some tiny habits of getting into it and doing it. Now, the worst thing you can do is get in there and do it gung-ho, because you're going to say it's just too much. My recommendation is to do a little bit, like do a 5-minute cardio workout on a bike, or go for a really brisk walk up a hill. That's something you can do. You can actually maintain the AMPK pathway, and it will help. It'll actually help produce more mitochondria to clear out some of the waste removal in your cells. But then you also need to do some type of strength training. Now, strength training, there's so many different things you can do. You can do heavy load, you can do perfusion, but my main thing is figure out some way to do that. I'm going to recommend this too. That muscle should be stimulated every 48 to 72 hours. So if you did it once a week, by the end of that next week, you've just wasted it. You need to stimulate it, and within usually 48 to 72 hours, hit that same muscle group again. I'm not saying actually hit and do the exact same exercise. I am saying hit the same muscle group again. You need to alternate these. You need to make it fun. You need to make it where it's not work, and you need to make it to where you can do this. Probably, my recommendation is if you're wanting to gain some size on your body, the best way to do it is, me personally, every other day. That's 6 days a week. Have a day off. If you really want to get big. At one point in time, I got into some bodybuilding and I put on a whole bunch of muscle really quick, and I was able to do it this way, and it works. But if you want to just hit it twice a week, which you can, my recommendation is do like chest, shoulders, and tris one day, back and biceps the next day, and then legs. And then some type of chest, shoulders, and tris, back and bis, and legs, and then the next day off. That's my recommendation. Do not go over 72 hours without actually exercising. Those are some of the most important things I can tell you as far as actually helping with brain health. Exercise and muscle mass. The exercise is going to help biogenesis with the mitochondria. It's also going to clear out some of that cellular waste. You're going to become better, more efficient as a person. So the more you do, guess what? The more you're going to have to do, because your body will get used to it and you'll be stagnant again. So you want to get to a point in exercise to where your mind, body feel good, and then you can kind of sustain that. The next thing is grow in some size. Again, I cannot stress this enough. If you want to grow in size, you have to ingest 2.5 to at least 4 grams of leucine. If you don't do that, you're not going to get the benefit out of the protein that you're ingesting. And again, that can be expensive. If you want things to happen quickly and you want to see some changes quickly, MTor, that's going to give you what you need to do. And the only way you can really do that is activating that by the amino acid called leucine. If you like this type of content, please follow Regeneration Essentials. If you want more information on a workout that's really easy, type workout in the comments. I will actually respond, and I can give you some easy workouts depending on your age and where you are. If you want to gain some size and actually be a bodybuilder, I could give you a workout for that. But most people just want to stay in shape. The older we get, we want to be able to have mind and body working both together in tandem, feel good, look good, and feel like we're not hurting. So again, if you have any questions, put them in the comments. Again, if you want to have me put in an exercise regimen program, I can do that as well. Just type exercise in the comments and I will message you.